Mr. Speaker, thank you for allowing me to be here this evening. As many of you may know, before coming to Congress, I was a physician in northern Michigan for nearly 30 years. And tonight I want to spend a little time talking to you about health care, Medicare, the President's health care bill, and just health care in general. In practice, many of my patients were on Medicare, and I know how important medical care is to our seniors. It's an important part of their ability to take care of themselves as they get older. And really, the reason I'm here today is to explain that the GOP and the Republicans want to preserve Medicare for our current seniors and for the youth that are coming up, because right now, the way Medicare is organized, the trust fund will be out of money within 10 to 12 years. Different accountants have different numbers. But basically, unless we do something, we're going to run out of money. And, we just don't want that to happen. I want to see people still have access to their care. And in discussing this issue, it seems as if we've been attacked for trying to end Medicare. But if you see that there's a problem with a system that is running out of money and you don't address it, that's just not right. The Doctors Caucus in the House is 18 physicians, nurses, and dentists that represent different areas of the country, and we have a good understanding of health care as it exists right now in America, and certainly there's problems with health care and access to it. I think that really the problem is that we have great health care in America. The problem is it's too expensive. And frankly, the President's health care bill makes it more difficult to keep Medicare viable. And those are a few of the things I want to talk to you about this evening, to just touch on to let you understand what I think about how the system is working and how we could improve it. I don't think it's a partisan issue. I think it's something that we need to discuss. And frankly, I just don't think that some of the people that have passed these laws in Congress really understood what they were doing. They admitted the fact that they passed the bill without really knowing what was in it. And I just don't think that's really a good idea. Well, what is really the problem with Medicare? The problem is that, the population of our country is changing. There's more older citizens than there were. In other words, there's 10,000 new Medicare beneficiaries being added each day. Right now there's a little over 3 people who are paying into the system for every person that's collecting. Because of the large numbers of people that are being added to the rolls, within a few years there's only going to be 2 people paying in for each person collecting. And that, creates a problem in the fact that there's not as many people paying in as receiving benefits, and it just, with the cost of the health care going up, it just makes it a fiscal cliff. The other big problem that we see with the Medicare situation is the fact that the President's health care law, in order to pay for it, takes $700 billion out of Medicare. Well, that's a lot of money to take out of Medicare, and to still expect it to provide care for our seniors, more and more of which are coming onto it every day. I think that there's certainly some waste, fraud, and abuse that can be eliminated, and that will help. But it's just not enough. We have to change the system, and the system that I think we should change to, frankly, is the system of Paul Ryan and Mr. Wyden of Idaho, who've thought together a program where we can put some changes for those people less than 55 that will allow them to choose between different private insurance plans similar to federal employees or members of Congress have. And these private plans would be inspected and reviewed by the government to be sure that they're adequate, and give people some flexibility in how they spend their money. I mean, one of the problems I see with Medicare is that the government ends up deciding how to spend the money rather than the patient. The patient, to me, is the one whose money it is. I mean, the people who are spending the money should be the ones who are deciding how it's spent, not some government person or bureaucrat in Washington. Let's talk. Show me the slide on the $700 billion. I just want to show people this slide that demonstrates what's happened to this money. Now, I represent the northern half of Michigan, and we have many small towns and small hospitals in my district. Every little town has their community hospital, and it's hours sometimes to the next facility. And this slide here shows the $716 billion coming out of the Medicare program. $294 billion of that money is payments to hospitals. So, the president describes his Medicare cuts as, cutting waste and overpayments to providers. Well, these hospitals are the ones that are providing the care. And as a doctor, I'd be a provider as well. But when you cut $294 billion from our local hospitals, I served on the board of a hospital. Our hospitals are operating at a razor-thin profit margin. They have to make stay in the black, otherwise they go out of business. They can't make their payroll. We've recently had a hospital in our district go bankrupt because of problems with their payments from Medicare. This is going to continue to happen, as we go forward, if we allow this president's health care bill to continue. $156 billion is cut from Medicare Advantage. $111 billion to be cut by IPAB and other provisions. $66 billion cut from home health care agencies. $39 billion cut from skilled nursing. $33 billion from FFS Medicare providers, and $17 billion from hospice care. And these are crucial programs for our seniors. With more and more seniors coming out of the program, how are they going to be provided care with less money? I don't see it happening. What's going to happen is there are going to be fewer hospitals, fewer places for patients to get care. So it's going to be difficult. In my district, we have to travel hundreds of miles to get seen. And I think it's pretty darn scary, to tell you the truth.